Hello, I shall be talking about professionalism, and it is a very important aspect and a topic to talk about because it has to be taught. And majority of the places earlier it was not taught or in the not it's not part of the curriculum. But now professionalism is part of the core competency. So the specific learning objectives in the next 20 minutes will be I shall be covering how do we define professionalism, what are its components, how to teach it, why to teach it. Then, once you teach, how do you assess that students have learned it and understood it? And then, if somebody does an act of unprofessionalism, then what are the remediation action plans? How do you sort it out? So, coming to the definition, medical professionalism is defined as a set of behavior to build a trust and relationship between the physician, patient, and public. The American Board of Internal Medicine defines professionalism as the internalization of a set of attitudes and behaviors in medical students and physicians which make them consider patients' interest more important than personal interests. That is the main crux that we always have to keep patients' interest before us. So the word professionalism is derived from the Latin professions or public declaration. Professions, as defined, are occupations granted special status by society so that professionals can deal with needs that are valued by the community they serve. Some people consider it to be an excellence in medical practice. Otherwise, some people consider it as certain standards, basic standards. And this is one of the core competencies that is must to know competency. So, why do we give so much emphasis on professionalism? So this concept of doctor of a profession has changed with time. Earlier doctors had the autonomy and the patients trusted the doctor. They considered doctor as God and they believed that doctors will always keep the welfare of the patients before their own. However, with passing time, this autonomy was challenged by the society and their perception of a role of a doctor. Doctors' behavior is now observed and scrutinized very closely by the media. Doctors' own attitudes towards their vocation also have changed. Medical errors, adverse outcomes, malpractice, and inappropriate behavior resurface when doctors do not adhere to the standard guidelines or when they have difficult workplace relationships with their professional colleagues or they find inadequate communication, collaboration, or transfer of information to the patients, or when doctors suffer from low morale, they do wrong things. So, why is it important to teach professionalism? There are a lot of market forces, pressure from society or administration, self interest sometimes comes in front of us. So, students must learn this at the early stage of their education and understand the consequences of failure if you don't understand the importance of professionalism. So topics like conflict management, feedback, supervisory skills, and assessment has to be taught to students in the beginning. Doctor's role is there to understand the healthcare system, to understand the clinical responsibilities. Doctor also works as a researcher, as a mentor or teacher, as a manager, as a team worker, team leader, and on personal development note, doctor has a lifelong learner, is always self-aware, self-confident, self-regulation about self-care, self-control, personal time management, management time with families or with self, then self-motivation, always committed towards doing the best in their patient's interest, always taking the initiative to learn and then to make the right choices in the career. The principles of professionalism are first, primacy of patient welfare, then patient autonomy, and social justice. These three are the pillars. Social justice, which means that we have to promote justice in the healthcare system and we should never discriminate patients on basis of race, gender, socioeconomic status, ethnicity, religion, or any social category. So we should never say that if oh, this patient is rich or this is known to, we should see this patient earlier. So these are not the defining markers of social justice. This is very difficult to practice when we are in the real world. Lack of professionalism happens when doctors abuse their powers, they have biases or sexual or mental harassment, they breach confidentiality and disclose the patient's documents, or they have arrogance in their behavior, or they have self importance. When money becomes the driving force, sometimes doctors may have greed, or they may lie to the patient and not tell the truth, or misinterpret the information with the intention to mislead the patient due to some interest. So, non cognitive skills like communication, how you speak, empathy, integrity, collaboration, which includes responsibility, respect, and duty, continuous improvement, that is, you are motivated to improve. Then, students must be provided with stage appropriate opportunities to experience challenges faced by practicing physicians. And then they can reflect on these in a safe environment. So that reflection becomes habitual and they learn it how do physicians deal with this in their daily life. There are many ways of teaching professionalism, like having small group or large group discussions, case vignettes, video clips, narratives, role plays. Professionalism must be taught instead of being caught. Reflections, simulations, journal club, team-based learning, problem-based learning, educational portfolios. So the key values expected from a doctor are high standards of ethics, continuing professional development, ability to work in a team, concern with the health as well as illness, have certain clinical standards. It has to be taught. Then interest in change and improvement, research and development. The challenges we face are the doctors from healers, from gods have become professionals with time. The old model of teachers being role models that has slightly changed. And when we teach professionalism, we are very honest to the patient and we speak the truth. Then there's also chance we expose deficits in our educational system. But that means that we need to work more to ensure an effective learning and assessment of this competency. So we should not hide from our patients the honest confessions. And students need to reflect these real life encounters in a safe environment, not when they really face in real life. That will be hard. So, professionalism includes competency, caring, being having concerns about patients' dignity, insightful, self-aware, taking the responsibility of one's action. If I do something wrong, I accept it and tell the patient, okay, this is my mistake or this has happened. I'm committed to the best interest of patient. I maintain confidentiality, altruism, which means unselfish regard for others, always keeping patient's interest before us, having integrity, honesty, trustworthiness, having the morality and ethics, having the responsibility to society for the public good and responsibility to profession, maintaining the integrity, morality, and how do we handle our professional colleagues, have the teamwork, we respectfully work with our all colleagues. And so all these are different aspects of professionalism. All these are part of professionalism. So student has to be taught from beginning all these things so that they understand that all this includes being professional. So how do you assess it? The Miller's pyramid starts from knows how, shows, and does. To check the knowledge of student, we can do MCQs or short answer questions or vignettes. Then to know how they understand it, we can have reflections, case-based discussions. Then to perform or show, we can have OSCEs or mini evaluation exercise. And does may include multi-source feedback from 360-degree feedback from everybody, healthcare outcomes, or critical incident reportings. So the three sub-competencies focused are professional behavior and ethical principles, accountability and self-awareness, and help-seeking. For example, if the student comes late at work and then we tell them the importance of punctuality, but in spite of that, they are persistently late. So this is an act of unprofessionalism. Then another example is lack of lapse in the core competency, that student comes late because the doing some other patient's work and not giving the priority in the manner in which work has to be finished. So they haven't learned time management, especially residents where they are both employees as well as learners. So they have to learn time management, they have to prioritize their things, plus they have to have professional attitude. So if somebody does an unprofessional act, how do you notify that? You are in the hospital administration, you have special boards, state medical boards, or authorities, program directors, which need to be consulted. You have to categorize that event as minor event, major event, or critical lapse event that it has caused the death of a patient. So like that. And then depending on that, you plan the action. So with this, I summarize saying that medical professionalism is not a genetic thing. It has to be taught. Either it's there or it is not there. And it has to be developed over time and it has to be assessed also. So we have to know how to teach, why to teach, what to teach, and then how to assess the students understood it, the importance of it. So I shall be discussing this role play by which you will understand the importance of professionalism. I'm just covering the aspect of duty and responsibility, honor and integrity. So in a surgical ward of a medical teaching hospital, the ward nurse asked the intern to discontinue the patient catheter in bed number 23 that underwent an appendectomy yesterday. The intern does this without checking order in the patients. So this is a mistake from intern. After a few hours, the same patient develops urinary retention and severe bladder pain. It is later revealed that the patient in bed number 22 had ordered to discontinue the catheter and not bed 23. So there was a mistake. The resident noticed the mistake of the nurse and the intern. The catheter is inserted again for the patient bed number 23. The patient complains why the catheter was discontinued. So patient has the right to know, has the autonomy to understand things. To solve this problem, the resident tells the patient, we wanted to send the urine collected at the beginning of the catheter to the lab for the culture test. So the catheter had to be discontinued and a new catheter inserted. The patient is satisfied. After leaving the patient's room, the resident reprimands the intern and gives him an extra duty hour. So the problem here is that intern did not speak the truth, did not take the responsibility of the mistake which has happened, or the nurse has not taken the mistake and not accepted it. So, be it a small mistake or be it a big mistake, you have to have honor and integrity, the honest behavior, and accepting responsibility for your work. So, I leave you at this note with a thought process that if you were that intern, what you would have done? Did you have hidden this information from the patient, or you would have spoken honestly to the patient and the patient would have trusted you more if you were honest? So you may think and ponder about this, and then you may understand that how much professionalism is important, how much it is difficult to always be professional in small and large acts. So with this, I thank you all for patient listening and being part of this session. Thank you so much.